Live from ZTN Studios in Harare, Zimbabwe. Welcome to the Mint Special. Our discussion, Global Goals Day of Factivism, Building Back Better in the Decade of Action. This broadcast is brought to you by Zim Papers TV Network, ZTN, and our partners, the Poverty Reduction Forum Trust, PRFT. Good afternoon, I'm Andy Hodges. Now, should you have any comments or views on our show today, please, as usual, contact us via our Facebook page, Zim Papers TV Network, or via our Twitter handle @ZTN News. Zimbabwe joins the rest of the world in celebrating the Global Goals Week from the 18th to the 26th of September 2020. The Global Goals Week is an annual week of action, awareness, and accountability for the Sustainable Development Goals, or SDGs. The objective of the Global Goals Week is to mobilize communities, demand urgency, and supercharge solutions for the global goals, whether it be digitally or physically. The highlight of the week is the Global Goals Day of Factivism on the 25th of September 2020, which in fact is today. Now, against the background of the devastating COVID-19 pandemic, it is important for Zimbabwe to take stock of what it has achieved since September the 25th, 2015, when the global goals were formalized, how the pandemic has affected the achievement of the goals, and how the country can build back better during the Decade of Action, which runs, of course, from 2020 to 2030. Join us on the Mint Specials this afternoon to discuss Global Goals Day of Factivism, Building Back Better in the Decade of Action. We are joined in the studio by Judith Cowlem, Executive Director, Poverty Reduction Forum Trust, PRFT, Mr. Mucheneripi Nemhara, Research and Economics Officer at Zimbabwe's Ministry of Public Service, Labour and Social Development. And we'll be joined virtually during the program by Dr. Esther Muya, UN Resident Coordinator and Interim UNFPA Representative. Ladies and gentlemen, welcome to the Mint Special.
Thank you, Andy.
Thank you.
Thank you, Andy.
Now, in our first segment, we focus on how far has Zimbabwe gone in implementing the Sustainable Development Goals, or SDGs. So, Judith, let me start with you. What does the Global Goals Week and the Global Goals Day actually mean for Zimbabwe? What is it? What are they? And are they important? And why?
Thank you very much, Andy, for that question. You have already spoken to most of what the Global Goal Week means in your opening remarks, which is good. But the Global Goals Week is not just for Zimbabwe. It's really global. So all governments that did commit to the 2030 agenda by signing them in 2015 committed to ensuring that there's improvement of human life and the planet. So this Global Goals Week really was put together to bring together the different actors, government, private sector, civil society, to look back and take stock. Where are we? It's 5 years into the SDGs. Where are we? And also that we are doing it at the time that we now have COVID-19. It is to say what actions, when we have taken stock of the progress, what actions need to be taken. And it cannot be business as usual now because there's COVID-19. So what precise actions can we all take? What precise actions can we also take to accelerate the implementation of the SDGs? So really it is a call. It is a week that is, yes, continuing to bring awareness about the SDGs, but we need to take stock.
A call to assess and take stock of where we stand.
Exactly, yeah.
We're now joined virtually by Dr. Esther Muya, UN Resident Coordinator and Interim UNFPA Representative. Esther, welcome to the program. Now, Esther, the 2030 Agenda for Sustainable Development adopted by all United Nations member states in 2015 provides a shared blueprint for peace and prosperity for people and the planet now and into the future. Now, at its heart are the 70 Sustainable Development Goals, SDGs. So briefly, what are the Sustainable Development Goals and what is the role of the United Nations in the SDGs implementation, particularly with regards to Zimbabwe?
Okay. Thank you so much for the invitation to talk about the sustainable goals and the role of the UN in Zimbabwe. And good afternoon again to all of you and the listeners out there. The Sustainable Development Goals, as has been said, is a part of the 2030 Agenda, which was adopted in 2015 by the 193 UN member states, including Zimbabwe. They are ambitious, they are comprehensive, interlinked, and also complex. However, when we unpack them to simplify, they actually comprise a set of 19 sustainable development goals for our focus globally and including Zimbabwe, with 169 targets that we hope to achieve by 2030. And how do we measure them? There are 204 indicators that are out there to really look how well are we doing in ending poverty, hunger, inequality, as you said, promoting justice, peace, gender equality, good health, quality education, jobs, innovation, environmental protection, and strong partnerships. And I think what's important, coinciding with the rollout of the SDGs, at the beginning of 2016, the UN support to Zimbabwe on SDG implementation has been guided by the Zimbabwe United Nations Development Assistance Framework for the UN support in Zimbabwe, simply called the ZUNDA, and it focuses on 6 priority areas: social services, protection, food and nutrition, security, poverty reduction, HIV/AIDS, gender equality, good governance, and public administration. Through this, let me let you know that we have been able to mobilize over the years US dollars 1.6 billion for the past 5 years in these priority areas, which has contributed to over 60% of the overseas development assistance to Zimbabwe.
Thank you, Esther. Muchineripi, Zimbabwe's Ministry of Public Service, Labour and Social Development is the custodian and coordinator of the SDGs implementation in the country. And I know that Zimbabwe is committed to implementing all of the SDGs, but with focus on 10 of them, 2, 3, 4, 5, 6, 7, 8, 9, 13, and 17. Of course, we don't have time to get into every specific one. The prioritization exercise was guided by the country's vision and the need to focus on enabling goals and resource availability, of course. So can you give us an update? Where do we stand as Zimbabwe on the progress we've made in implementing the selected 10 SDGs that you're focusing on? And, you know, since 2015, a progress report. And I know Esther mentioned 204 indicators to measure performance. Can you give us a report?
Okay. Yes. Zimbabwe is committed to the implementation of all the SDGs, of all the 17. But it's only that focus was given to 10 SDGs with the idea that the implementation of the 10 SDGs will translate to the achievement of the other 7 SDGs. We have noted some progress, especially in health, where the number of malaria infections per 1,000 people have reduced since 2015 after the adoption of SDGs due to the programs that were implemented by the Ministry of Health and other partners to curb the prevalence of malaria in Zimbabwe. We have also noted some progress in SDG number 4 on education, where the number of enrollments is increasing from 2014, from the figures that we have, some enrollment is increasing. And also, we have the number of schools that have access to electricity that is improved to more than 75%. That is both for primary and secondary schools. And also, the number of schools with water sources have improved to around 90% in Zimbabwe at large. And we are also concentrating on promoting employment. That is for goal number 8, which is goal number 1 on the list of prioritization, where some projects are being done in order to promote green jobs. You know, we have to reduce greenhouse emissions. So we are working on promoting green jobs. And also, we still have an increasing informal sector in our country that is contributing to the development of the nation. So we take that as employment, and we can gladly say that since the informal sector is regarded as employment in our country, and it is contributing immensely to the development of the nation. The unemployment rate is around 11%, at 11%, according to the 2019 Labor Force and Child Labor Survey. And also, we are noting some progress in SDG number 2 of ending hunger, where government is implementing some projects that are aimed at ending hunger. Some of the programs that are being implemented include the Command Agriculture and the presidential inputs that is giving, that is providing farming inputs to people who are conducting farming activities.
All right,
Thank
you know, Judith, you saw there that Mucheneripi mentioned a couple of progress that we've made in some of the goals. So as a civil society organization, what is your comment? And further, have you identified any opportunities and gaps?
Thank you, Andy, and thank you, Mucheneripi, for that submission. Like Dr. Esther said earlier on, talking about the indicators and the targets that we use then to monitor and track. So it is the indicators that tell the story. What do we see with our eyes on the ground? So if we pick, for example, the SDG on poverty, which is SDG number 1, we know that if we use even Zimstad's information, that the total poverty consumption line is around 11,000, it was in June, around $11,300 Zimbabwe dollars. And we know that...
I think it's now 17,000 for a family of 5.
I think it's around that now. So that's an indicator we are using. And the question we ask is, how many people in Zimbabwe on a monthly basis get that? Mucheneripi has talked about the informalization of the economy as being employment. What is the disposable income that people get from the informal activities that they do? And we know the nature of informalization, the precarious jobs that people do. So really, at the end of the day, from our perspective, we wouldn't use that as a positive indicator. The high level of unemployment, the official rate, the official percentage, which is 11%, but we will use the percentage that we believe in, which is around 8%, because that's what we see on the ground. Okay. So really, we have seen a high unemployment, and also, if we look even the issue of education that he talked about. Enrollment by itself is not enough. As a country, for a long time, we have really bragged about having the highest literacy rate in the region, or maybe even in the continent, but that too is not enough. We need to look at quality. So our quality has really gone down during this period that we are talking about, which is a cause of concern.
Judith, we'll continue on that, but I want to bring Esther in. Esther, I can just briefly ask you this, because we do have to take a breather. You've heard the comments from the panelists in the studio. What would be your brief comment in terms of progress that Zimbabwe has made in implementation of the SDGs?
Yeah, I think within our role as the UN in advisory and technical support as well as financial, looking and monitoring progress and reporting, Zimbabwe has started making progress. However, some of the gains that have been made are actually being overridden by some of the events that are taking place in the country beyond the control of the country. So there is progress, but some of the gains made are being undone. In some areas, the progress is slow for various reasons that my sister has mentioned, and also which we are aware of and are addressing as we move along.
Thank you. I will obviously come back and talk about issues that are affecting implementation of SDGs, and I think the big one, of course, is COVID-19. We now have to take a breather. You're watching the Mint Special, Global Goals Day of Factivism, Building Back Better in the Decade of Action. This is live from ZTN Studios in Harare, Zimbabwe. This broadcast is brought to you by Zim Papers TV Network ZTN and our partners, the Poverty Reduction Forum Trust. In our next segment, we ask, are citizens involved in the implementation of the Sustainable Development Goals? And does the United Nations play a role in the exercise of citizen engagement? Don't go away. The Mint Special will be right back. Welcome back. You're watching the Mint Extra. And also you're watching our discussion today, Global Goals Day of Factivism, Building Back Better in the Decade of Action. This broadcast is brought to you by Zim Papers TV Networks, ZTN, and our partners, the Poverty Reduction Forum Trust, PRFT. Muchine MEP, critics have argued that the general population of Zimbabwe is just not aware of the SDGs, what they are, and even all the numbers that we spout here, 1 to 17 and 1 to 10. They have no clue what's involved in them. And there seems to be little or no public awareness programs being run by government. Your comment on this: how is the Zimbabwe government making sure citizens are involved in the implementation of SDGs?
Okay, thank you, Eddie. We, as government, we are engaging the public on SDGs through various channels. We have the clusters that are in place. These clusters are comprised of government ministries, development partners, civil society organizations. Since we strongly believe that civil society organizations, they work hand in hand with the communities on a daily basis. So we are having engagements with them through the three clusters. The one that is chaired by the Ministry of Public Service, Labor and Social Welfare. Then there's another one that is chaired by Ministry of Health and Child Care. Another one by the Ministry of Lands, Agriculture, Water and Rural Resettlement. And we also have engagements with Parliament, where there are two committees in Parliament that are overseeing the implementation of SDGs. And you know that the parliamentarians are those that work also directly with the communities. So there are two committees. We have a committee that is comprised of senators, and another one that is comprised of all chairpersons from the parliamentary portfolio committees that are looking into SDGs. We have also started the local reviews on progress in SDGs, where through the Ministry of Local Government, we are engaging local authorities. So those processes will assist government in raising awareness in various communities.
But you would agree, though, it's a true statement to say, if you had to go out there on the streets of Harare today and say to someone, what are the SDGs? I think 9 out of 10 people would not be able to answer you or tell you what they are. Would you agree with that statement?
Yes, we are aware that there's still some work to be done, especially in raising awareness on SDGs. That is why we have lined up some programs, especially for radio programs that are in line up. It's only that some of the activities were slowed down by the COVID-19 epidemic.
Yeah. Okay, Judith, I want you to also comment on that issue about awareness of citizens, but also this. I mean, the 2030 Agenda for Sustainable Development and its Sustainable Development Goals back in September 2015, civil society played a very active role in the implementation, or rather the process. And in fact, there was advocacy by CSOs carried out, and through this engagement, civil society, in fact, helped shape the 2030 Agenda. So how have CSOs in Zimbabwe and citizens been participating in the SDG implementation? And in your opinion, what can be improved to ensure that no one is left behind?
Thanks, Andy. I think we want to acknowledge that civil society in Zimbabwe is diverse, representing different sectors. So you would find each would follow those that appeal to the mandate that they are carrying out. So in that regard, civil society would have contributed in many ways. I'll speak about the Poverty Reduction Forum Trust and the Zimbabwe Civil Society Reference Group on SDGs that we set up, which is really an attempt to bring together civil society so that we work in a collaborative manner. And that is a setup that government has also acknowledged. What Missionary was talking about, the clusters, we applaud that because it has created a space for civil society through this reference group, which is limited, though, to participate in the processes. Through that process as well, we've been able to engage government and collaborate on radio programs that we undertook a couple of years ago to sensitize on the SDGs. But I guess the challenge is on sustenance. Some of them have been ad hoc processes. So I think moving forward, there is a need to really institutionalize how government engages with civil society.
Esther, let me bring you in now. How does the UN family interact with citizens, CSOs, and other stakeholders in the implementation of SDGs? And how important is it that there is inclusive buy-in to the SDGs and that so that it doesn't just remain a governmental initiative?
Okay, thank you. Just to follow up and to complement what my sister and brother have said, as you say, awareness raising is very important. We know that the government takes the lead in implementation for the achievement of these goals. However, no government anywhere can attain the SDGs alone. So, like you say, multi-stakeholder engagement and innovative partnerships are critical to achieve these goals. As you say, if you walk out in the street asking people what are the SDGs, they may not even know what SDG means. And therefore, as part of our role, we are engaged in awareness raising with government ministries to simplify, to unpack the Sustainable Development Goals, and also to work with the different levels of government, and as has been said, members of parliament. However, we are also through various forums, traditional leaders, through the media, through youth organizations, with civil society, working on private messaging out there to allow awareness-raising campaigns to go on. And these are have been set up by different groups in their own initiative, including the Civil Society Reference Group that has actually convened us here today. We are working together, but for every level, we look at what do we want to get out there so that people can become engaged and help move the agenda forward.
I think you've made a good point, and in fact it was my next question to you, because of course Zimbabwe is very heavily rural, and I think most of Africa is. A lot of our population lives in the rural areas. So there must be sort of examples that you can cite of other African countries and how they've disseminated information about SDGs to the population at large and not really just focused on knowledge given to the cities. Do you have any examples of the best ways that this can be done in a situation like Zimbabwe?
Yes. Okay, let me just give a simple example of our continental sister, Rwanda. Rwanda went through a turmoil, and bringing in the SDGs was one of the ways to refocus the government's attention and to bring every citizen and leave no one behind, given the history that had been there. And what did they do? They have brought together people, even at community level. So take, for example, on health and environmental cleanliness. In Rwanda, every Saturday previously, they used to gather and you clean up your community. That is how to engage the community. When it improved, they now do it every first Saturday of the month. They have what they call Omuganda, and they bring together citizens, and they use community leaders to rally people around. And Zimbabwe has actually picked up that very well. And I think if we did it better than we are doing, we will even overtake Rwanda in our cleanliness, environmental cleaning, and towards a healthy environment and healthy living. So that's just one example of something that has succeeded in a country. Everybody says Rwanda is in the first lane, and I think Zimbabwe can get into the faster lane even if we can pick up some of these simple unpacking what makes sense to the local citizen, to the local, national, rural or urban, so that we are leaving no one behind. And I think COVID has been a good teacher for us. Mm-hmm. What did we find is the magic bullet for COVID prevention? Wash your hands with soap and water.
Which of course goes to the access to water for all people, which is somewhere involved there in the SDGs.
So the government then ensures there's water available,
right,
and allows citizens to have access, everybody, to have access to water and soap. And even if you don't have soap, if you wash even with lemon or with salt, do you know you can clear the virus?
Right. Right. Just let me come back to the panel here. Judith, you have a comment on that? Because this is a critical area, isn't it? Understanding. Exactly. And I think this is what this whole week is about, is it not?
Exactly. And I like the example that Dr. Esther has used of Rwanda. right? Because I think we need to demystify what SDGs are. In your earlier question, and you gave an example, if I were to go into the street and ask 10 people, probably one would know. Because you ask, what are SDGs? What are they? That's very elitist. But if you ask somebody, do you have clean water in your house? Do you have shelter? Do you have an accessible road or clinic?
Or jobs even.
That's what relates to them. So in that case, we want to be able to bring it to the people through the language that we use. So even in terms of communication, there have been efforts to use jingles, to use skits, to translate into vernacular so that people can appreciate. It's about what relates to them. So I really think there is need for us to continuously demystify the SDGs, because that's lived experiences. If you look across the 17 goals, they are speaking to day-to-day lived experiences of people. So let's talk about that. Yeah.
Mucheneripi, do you have any comments? I mean, you've heard both of the panelists, Judith and Esther, in terms of this whole issue of how to break it down, how to bring it to the people. And I see Esther's, Judith's point about, when you talk SDGs, SDG 1, SDG 2, people don't really understand you. But if you say, have you had clean water? Have you got access to education? Has your situation improved economically? Any comments on?
Yes, I strongly agree with what the other colleagues have said. For sure, if we just say SDGs, to others it doesn't make sense. But every day, in their day-to-day life, they are implementing activities that are related to SDGs. But what is needed is to speak in the same language with them so that there will be understanding at all levels of the community, from the community.
There we go. Definitely much more communication is required to teach the population what SDGs are, and also, as Judith and Esther have said, break it down to understandable bites so people actually understand how SDGs can affect their lives so that we can all get behind them. We now have to take a short breather. You're watching the Mint Extra, Global Goals Day of Factivism, Building Back Better in the Decade of Action. This is live from ZTN Studios in Harare, Zimbabwe. This broadcast is brought to you by Zim Papers TV Network ZTN and our partners, the Poverty Reduction Forum Trust. In our next segment, we ask, what has been the impact of COVID-19 on the implementation of the Sustainable Development Goals? And how does Zimbabwe get back on track to achieve the SDGs by 2030? Don't go away. The Mint Extra will be right back.
Life will never be the same again.
Absolutely. No. How do you tell someone in Mbaria or in Soweto that they should exercise social distancing?
Every single one of us, barring a few, are praying more.
What is the health economic cost of what we are trying to achieve?
I don't know whether his chairman knows he runs at about 9 in the morning.
Yeah, I've just got the symptoms, so I just called the doctor and then he just advised me to have to stay at home,
Welcome back. You're watching the Mint Extra, and of course our discussion, Global Goals Day of Factivism, Building Back Better in the Decade of Action. This broadcast is brought to you by Zim Papers TV Network ZTN and our partners, the Poverty Reduction Forum Trust, PRFT. Mucheneripi, before the COVID-19 pandemic, critics alleged that most countries, Zimbabwe included, were already behind and in danger of not achieving the SDGs by 2030. So what has been the major impact of COVID-19 on the achievement of the Sustainable Development Goals, and how has the government responded?
You can say that the lockdown measures that have been imposed have caused a lot of adverse effects, especially on the economic activities. The economic recovery agenda has been revised. Now, the economic growth is depressed due to closure of companies, closure of borders, where we mainly depend to take our raw materials for production processes from other countries. And also, there's increased number of households that are in need of food. So food security has been affected, together with the health sector systems that has been undergoing pressures which were not anticipated before the advent of the
But then
pandemic.
again, okay, we can look at both sides, yes? You can see, for example, jobs may be down, of course, because of COVID-19 and the lockdown. But on the other side, surely the additional spending on health and so forth, and even going into e-learning, would have boosted some of the SDG goals. What would be your comment to that?
Yes, we are happy that especially the introduction of e-learning to other communities have boosted the need to innovate in the country. So other people are now learning through online platforms. But the challenge is that there are people who are in rural communities who do not even have access, who cannot afford to buy data so that they can learn online. So these are still left behind.
I think health is one area, I think, in COVID-19 that I would hope that we could have said we had improved or had made more progress towards SDGs. Judith, I'll come to you. I just want to go across to Esther quickly. Now, Esther, COVID-19, of course, threatens to reverse progress on some of the global goals. And, of course, the pandemic disrupted implementation towards many of the SDGs. And, in fact, in some cases could have turned back years of progress. Now, here's an interesting question. Do you think that if the world or certain countries had been on track to achieve the 2030 agenda, it would have been better prepared to deal with the pandemic?
You're right. If the world had been better prepared and had made a lot of progress on a number of the SDGs, remember we are only 10 years away from 2030. And with the pandemic setting in, it would have, the impact would have been less. Of course, it would have still hit the world, but the impact in those countries that had made progress could have been better. However, don't forget Zimbabwe was already grappling with severe drought, and we still had the residual effects of Cyclone Idai from last year, March. Before a year was over, the socioeconomic hardships were there, and then landed the threat of COVID-19 pandemic. So what happened was this really now even reversed some of the gains that had been made. Like you say, the health sector was heavily affected. The education sector was heavily affected. The agriculture sector everywhere. And that's why within the UN in March this year, we had launched a humanitarian response plan for COVID-19 worth 800 million that could help meet the needs of about 6 million vulnerable people, which is about 40% of Zimbabwe's population, with food assistance. Because remember, if you don't have food, as Judith said, on the table, and then the pandemic sets in, what state is your immunity in? Then you look at water, sanitation, and hygiene, like I had earlier mentioned. It is critical. What were the footsteps that the progress we had made in that area? Now we had to close down all the social sectors just to prevent the spread. And what is it? Education. What has it done to our education sector? And that's why we are looking at how can we have measures in place to allow people to go back into the state to be able to continue to live a life that is of value added. And it is because of this, so far, we had about $85 million committed to respond to public health crisis and the secondary impacts of the COVID-19 pandemic, especially for the vulnerable and marginalized population of Zimbabwe. So since the launch in March, the UN has actually helped to mobilize over 170 million of the appeal to about 20%, over 20% of the total appeal towards 2019, so that we could help. Because remember, the traditional donors were hit even harder than we were hit. So how do you expect them to come in to help us when they are grappling with how to deal with it? And therefore, as Zimbabwe, we had to figure out how to stand up. And as a UN, we came out in the forefront. We helped reprogram whatever little resources were available. And again, under the humanitarian response plan, and we have come up with a socio-economic framework with additional interventions to add on to the regular development program, which initially was focusing only on SDGs, to make sure that at least we have about 400 million under the ZUNDAP to be able to help Zimbabwe still not lag behind, but look at how it can then catch up towards the target SDGs that they have put in place.
All right, thank you. Judith, you heard there the UN, the tremendous work the UN is doing to assist Zimbabwe. I mean, 800 million appeal, 170 million mobilized, particularly looking at vulnerable families, 6 million vulnerable families, particularly on the food security side of it. So we applaud the UN for their help to Zimbabwe. But your comments on the impact of COVID-19 on SDG implementation?
Thank you, Andy. Earlier on, you asked Dr. Esther whether if countries around the globe, those that were on track, if they could have done better in responding. And I think that will be my starting point. And I agree with you that, yes, they could have. As civil society organizations, we have always demanded or asked engaged government and are calling for efficient, accountable, transparent use of national resources, which we believe that relatively we do have enough if they are efficiently used. So we have always argued for efficient use of resources to address the challenges that have now been put on spotlight by the COVID-19. For example, if you take the issue of rural electrification, if resources had been put earlier on to ensure that all corners of the Zimbabwe country are connected on the grid, now with COVID-19, we wouldn't see the disparities, the inequalities that we are seeing, especially in education, where for 6 months we have had more children. We have not set side to anything that is educational because they are in the dark, right? So really already that is a long-term impact on development. So if resilience had been built earlier on, we would then have been found in a better position to respond to COVID-19. We also see the disproportionate impact that it has. We have women's organizations, civil society organizations that for a long time have been calling for empowerment of women and girl children and the vulnerable groups. But because that did not happen enough, we now see that with COVID-19, those are the groups that are tremendously affected beyond what anybody can comprehend. Yeah.
Right, now we are coming to the end of the show, and I want to ask you this, all three of you, this last question. Let me start with you, Esther. And of course, it relates to our topic today, which of course is Global Goals Day of Factivism, Building Back Better in the Decade of Action. So in your opinion, Esther, and as I said, if you can be brief, how do you think Zimbabwe can build back and make sure that we achieve the SDGs during the Decade of Action, which of course ends in 2030?
I think there are a few areas that we could focus on in Zimbabwe. One, we have to prioritize and see what is most affecting the vulnerable people and what do we do about them. So make sure that we actually target the most vulnerable populations. I'm talking about the urban poor, I'm talking about the rural poor, I'm talking about the huge the cohort of young people who are jobless. How do we make sure that they're gainfully engaged to be productive? Because right now we need Zimbabwe to start being productive. And 3, we need to have systems and structures in place that will actually facilitate and invite further investment into Zimbabwe, while at the same time looking at the investment that will actually yield for those social sectors that we are looking at, the health sector, the education sector, the labor sector, the welfare sector. And once we are able to start looking at that and prioritizing, and final thing is build strong partnerships. The partnerships doesn't just mean partnerships of government and donors. It means partnerships with civil society, partnerships with leadership at all levels, and partnerships with the citizens, using all available entry points to be able to include everybody, and that will allow us to leave nobody behind.
Thank you, Missionary P. Okay, you heard what Esther said. They prioritize, targeted at the most vulnerable, urban, rural, poor, young people who are jobless, try and get them into doing more productive things, and of course build strong partnerships. So the same question to you: how does Zimbabwe get back on track? Can we achieve the goals by 2030?
Okay. Firstly, is strengthening the partnerships between the public-private partnerships, and also to work together with civil society organizations and other development partners in the implementation of SDGs. Also, what is more important, we've seen that many countries were now concentrating on the effects of the pandemic in their own countries. So there is need for resource mobilization to be strengthened, domestic resource mobilization to be strengthened in our country, so that we will achieve the SDGs. And also, awareness raising will play a critical role in achieving the SDGs.
Okay. Judith, your final word, you have the final word in terms of what we can do to build us back. And of course, bearing in mind that even though COVID-19 did come along and has created this sort of effect on the implementation of SDGs, some of these issues were there before COVID-19 and will remain after COVID-19. Maybe your final thought.
Thank you, Andy. I think this is an opportune time for Zimbabwe, because the government is in the process of developing the next 5-year development plan, the National Development Plan #1. So it's an opportune time to now say, with the experience of COVID, we can do better. In those areas that we did not do well, that my colleagues have highlighted, and make a commitment through budgetary allocations and disbursements. It's one thing to have a beautiful plan that will probably align the next 5-year development plan to the SDGs and their targets beautifully. But that by itself does not translate into transformation. We need to see a commitment. The first commitment is really allocating resources. And like we are saying, we have capacity and we have resources domestically to do that. Where partners come in, like the UN, which we greatly appreciate, then they come in to complement. But there must be demonstration from government. And also another thing, Andy, Dr. Esther talked about partnerships as well as Mchineripi. I think those partnerships, we also don't have to sugarcoat them and make them window dressing and box ticking exercises. Civil society organizations in our diversity generate useful data that can complement our government in their effort either to implement or to monitor progress. So we need that partnership that acknowledges that citizen-generated data that we have.
I mean, what I find fascinating, of course, is that, you know, the COVID-19 pandemic, of course, is terrible, and many people have lost their lives, which is absolutely terrible. But, of course, it also highlighted the deficiencies, for example, in the health sector. And it shows that with the kind of strain of a pandemic, what the deficiencies were, what needed to be fixed, what needed to be put in place, and so on. So in a way, if you look at some benefits that have come out of COVID-19, is at least awareness of what needs to be fixed and needs to be done. Right, I think on that note, we have come to the end of our program, and a very exciting program that has been in looking at implementation of SDGs, of course, and our discussion today, Global Goals Day of Factivism, which is today, if I'm not mistaken, the 25th of September, and it's building back better in the Decade of Action. We'd like to thank our panelists, Judith Kaula, Executive Director, Poverty Reduction Forum Trust, PRFT, Mchineripi Nemara, Research and Economics Officer at Zimbabwe's Ministry of Public Service, Labour and Social Development, and Dr. Esther Muya, UN Resident Coordinator and Interim UNFPA Representative. Ladies and gentlemen, thank you so much for appearing on the program.
Thank you for having us.
It's a pleasure. Now, this broadcast is brought to you by Zimpapers TV Network, ZTN, and our partners, the Poverty Reduction Forum Trust, PRFT. Well, that's it from us this afternoon. I'm Andy Hodges. Goodbye. Have a great weekend ahead, and you all be safe.